Hi, I'm Dr. Russ Hornstein. I'm a chiropractic neurologist, and I'm going to take a moment and tell you a little bit about what adjusting to neutral is, why we might want to use this technique, or why as a patient you might want to have this technique, and how the technique works. So first we have to kind of go back to where this all started from. And it really started from my question of why we need to keep treating the same joint again and again. How come when we adjust a joint, a few days later, we'll see the same problem there? We know we can see some benefits in the patients, not only in their function and the mobility of their joints, but also other types of systemic problems can seem to go away. And what we can do is through our understanding of neurology, we can start to understand how the system is working, what it is, what changes we're creating in the system. And then when we start to look at that and understand what those issues are that we're addressing, then we can see why what we're doing isn't lasting and how we could do something else that could have a much longer lasting effect. So I'm going to try to explain that as briefly as I can in just a few minutes here. So one of the things that happens is that we know when we adjust, we can create a change in the length of a muscle. So if a muscle is too tight and we have a limited range of motion, we can put the joint at the end range and stretch it further into the paraphysiologic space, create a relaxation of the muscles, and get an improved range of motion. With adjusting to neutral, we're approaching it from a very different perspective. We are still creating stretch on muscles that are too tight and resetting their gain. But what we're doing is we're focusing on different muscles. So when you take the joint to the end range, we're going to be stretching both the deep and superficial, or the intrinsic and extrinsic muscles, and we're going to be stretching all of them. So the superficial muscles or the extrinsic muscles are really under voluntary control. So if you stretch it and you get it to switch off for a little while, it's using resetting the gain of the inverse myotactic reflex, we're going to create a muscle that has a lesser state of reactivity or excitability, if you want. But because it's under voluntary control, when we start using that muscle again, it's going to increase in its tension. As well, some of those extrinsic muscles might be tight because they're compensating for something else. So as we start to look at the mechanics of the joint, when a joint is not functioning properly, generally what we're going to find is that there's a problem with those intrinsic muscles. So if the intrinsic muscles are out of balance, and I'll explain why in a moment, if those muscles are out of balance, we don't have a mechanism to bring them back to balance. So in other words, they're under a reflexive control system. So if something has done something to affect, in other words, say you had some force that's kind of stretched your joint away from its neutral position, like a trauma, that's going to change the reactivity of those muscles that have been stretched, particularly these intrinsic muscles, and extrinsic muscles. So any kind of force or trauma that's going to drive your joint away from its neutral and stable position can have the effect of changing the reactivity or the capacity of those muscles to contract. It has a much longer lasting effect on intrinsic muscles. So that's why you can have a car crash or some sort of accident, and the whiplash, the effects of the whiplash can last for the rest of your life because we don't have an internal way to kind of recalibrate the activity of those muscles. So what we're doing with adjusting to neutral is we're paying particular attention to those intrinsic muscles. Again, they're not under conscious control. We don't have a way to recalibrate them. But what will end up happening is after a trauma, when some muscles get stretched, the opposite muscles will get tight, these intrinsic muscles. And so what we're doing is we're ending up in a situation where some of the intrinsic muscles are actually holding that joint in what we call a subluxated error or joint position error position that is not allowing it to get back to its neutral position. And effectively what's happening is those intrinsic muscles have a very strong stabilizing role. So if some of those muscles are less reactive and less capable of contracting, we'll end up with a joint post-trauma that's unstable. Our body will generally start to find a compensation by recruiting other more superficial or extrinsic muscles, or muscles that would normally be under voluntary control, will be switched on by our nervous system to try to take the role of that stability. And the way that it does it is it starts to contract muscles that'll keep your joint from going towards that vector of trauma. And in doing so, what we see clinically is that the person can't move their head in a certain direction. So those extrinsic muscles are actually fighting for one, they've been put there to cover up or try to make up for the intrinsic weakness or instability in the joint post-trauma, but they're also going to compromise the joint because you're going to have a lesser range of motion in that traumatized vector. So if we're going to be driving the joint to its end ranges, there's a quite high potential that we're actually just removing that extrinsic compensation and leaving the joint unstable unless we're also doing something to drive the joint back towards a neutral position. But generally, our adjusting, if it's end range, it's over several joints on both sides, and it's not really going to be doing anything to address specifically those intrinsic muscles and rebalance those. So the whole concept of adjusting to neutral is what we do is we teach you about the mechanics of the joint, how the joints actually rotate. So we're going to be looking at what the plane of action is of every joint and how it actually rotates. So it doesn't rotate in kind of a Cartesian sense. It rotates according to the axis of the through the plane of action. We're also going to be talking about translational motions of the spine and how those take place to allow coupling of motions in our spine. So what we're going to be talking about in Adjusting to Neutral seminars is going through mechanics of how joints actually move, how these intrinsic and extrinsic muscles play roles in not only creating stability, but also guiding the proper biomechanics of the joint, and also what happens to our joints when they've been traumatized. So when we have a joint trauma, we're very often left with this instability and with extrinsic muscles contracting. Now, the thing that brings patients in is the fact that these extrinsic muscles are tight and painful. And if we're just focusing on massaging those muscles or doing therapies to make those extrinsic muscles relax, or just stretching the joint in a way that's going to really just kind of relax those extrinsic muscles, it won't last. It'll only last for a few days. And if we're not specifically addressing those intrinsic muscles and the balance of those muscles, then we're going to have less success of having lasting results. However, with adjusting to neutral, what we're doing is we're putting the joint into its position where it's stuck or where there's that imbalance, and we're finding specifically the resistance of that joint going back to neutral. So when we drive the joint with adjusting to neutral, we're taking the joint from its position where it's stuck, like one joint, sometimes two joints. You take it from the position of where it's stuck, and we literally just drive it back to a neutral position. So we can very, very specifically address the intrinsic muscles without having any stress on extrinsic muscles or trying to reset the gain of those. So when we get the intrinsic muscles balanced, the joint is then calibrated. It will then be stable because now those intrinsic muscles are both at a greater balance of reactivity. So we see a greater potential for stability straight away. And we also see, because those intrinsics have such a strong role in the biomechanics of the joint, we also can see a very big change in the mechanical function of the joint. And when the joint is stable and mechanically functioning well, we'll also see that there's no need for these extrinsic muscles to be tight. And very often in the first treatment, we even see those extrinsic muscle tensions just drop away. They'll literally just melt. So we can also improve that full range of motion of the joint as well. So this is all very, very exciting stuff. It makes perfect sense when we understand the neurology. So in these seminars, I go through, myself and my colleagues, we explain the neurology behind how this control system works, and we'll explain to you how we, the process of how we diagnose the vectors of failure of the joint and where the joint is failing to come back to its neutral position. And we also we have other seminars, so that's really the biomechanics seminar. We have other seminars like the integration seminar, where we're really looking at the effect of that change of proprioception from the joint that's subluxated, or you have a joint position error where it's not moving or it's not moving well. We have a sort of a deafferentation from it not moving, or a disafferentation from it moving badly. That's going to create proprioceptive errors, and that's going to have an effect on our brain and how our brain has a sense of where we are, where is gravity, which way is gravity acting on me. That has a very, very profound effect on our ability to know where we are and how we're moving, both at a conscious and unconscious level. But when that system gets thrown off or decalibrated, it can also have a lot of autonomic effects as well, because these inputs are very, very important for our body. To know where we are and how we're moving is very directly connected to our autonomic outputs. So we need to mobilize fuel and to stimulate the system if we have some sort of a fear response, or we have some sort of need to drive or run away. At the same time, if our brain doesn't know where we are, we become less capable of being comfortable where we are. So it's essentially the system becomes unstable, and we'll explain exactly how that happens. So that small perturbations can actually create a stronger reaction of your body, and we get these sort of autonomic results. So this is something very, very interesting. And then we also have another module as well about diagnostics, and that's basically kind of going from the outside in. We're looking at how people present to the clinic and how we can interpret their presentation according to these principles, and how we can boil that down to understanding what we want to address first. So anyway, thanks for sticking with me. It's been, maybe about 11 or 12 minutes now, but thanks for watching. I hope that explains some people's questions about what adjusting to neutral is. And if you're interested in the seminars, look us up on adjustingtoneutral.com. And if you're interested in finding a practitioner, hop on the website and send us an email, and we'll find someone in your area that's practicing the technique. Thanks for watching.